A comment. Thank you, Deepa. So I am Dr. Narda Robinson, founder and CEO of CuraCore Vet and CuraCore Med. And today is our first day on YouTube Live. So we're still getting used to things a little bit, but happy to do this and happy to have some fun with you looking at anatomy. So we're going to be talking about the mighty multifidi and their impact on pain, posture, and performance. So these are representations of multifidi in the human spine. And the only muscles that are more medial to that are going to be your rotators that I don't have depicted here, and interspinal muscles, if they're in that given species, that run from spinous process to spinous process. So the multifidi are not something that has very often been described in veterinary medicine, but in both veterinary and human medicine, there's been a lot more interest in how these muscles impact movement and pain problems. What happens when you have trigger points in here? How can we strengthen them? And I think that especially for our small animals that may have had a disc problem, and not only are they perhaps non-ambulatory and paraplegic, so in through here, let's say they had a disc issue, then we also are now thinking, well, what happens with the back and the integrity of the back when there's surgery? Because these muscles are so deep, and this is the whole length of the multifidi from the axis down to the sacrum in the dog. So let's just put that in the screen here. And so if you're going to have surgery in the back, then how do you get to that area? How do you do a hemilaminectomy? How do you get into the disc material? Well, you're going to go through those multifidi. You're going to move them or damage them in some way. And the thing is, they're very important for proprioception and for spinal stability. If we look at these, and we'll get back to the other dog in a second, but the multifidi run from C2, so the atlas, over the entire cord, cervical, thoracic, lumbar, and down to the sacrum, even down to the tail. And so they are considered individual muscles, but the more that researchers have explored their anatomy and their connections, especially some human work where they've done probably the most in-depth just analyses of all the different connections, what they're finding is that the multifidi are actually working as a unit. So let's get back to this camera. And that's what multifidi means, is multiple slips, many little individual muscles. And like I said, they're being more explored, but the default description that you might find, let's get some water here. The default description that you see is often that it's coming from the side of the spinous process, so here, and going somewhere on like the lamina, somewhere on that vertebral body. And oftentimes it is covering and attaching to the superior facet aspect of that zygapophyseal joint. But all these facet joints that are what cause the spine to move and are highly innervated. And so they may be crossing it, they may be attaching to different parts of it, but each multifidus could be attaching to one vertebra down or two vertebrae down or three, sometimes even four, sometimes even five. And so it varies a lot. I didn't depict it with that much variation on this, but it's a really highly complex interdigitating, interfasciculating muscle system. And the more that we're looking at fascia and the unifying aspects of fascia, the way that so there's communicating going on between these different muscles, even if they're on different levels of the spine. So let's take a look back at that. So with this guy, yeah, we have a cervical part, thoracic, lumbar, and sacral, but they're not all that individual in their musculature. They are making interconnections. So why I say they're mighty, I mean, they're small, but there's many of them that go through the whole length. And what they're going to do is stabilize the spine. And um, we can think of the activities that, for example, a dog might do, and or a horse or a cat or whoever, human. And how do they stop fast? What's going to happen to that motion as they're jarring their thoracic limbs or jumping up and landing on their pelvic limbs? What is happening that um, is going to transmit force-wise into the body? Well, these multifidi kind of modulate that. They help disperse the impact. They help translate it to different areas of the spine. And also, the information is such that the um, the afferents will go to the brain, and we're just getting more information about where our spine is located in space. How do the thoracic limbs and pelvic limbs need to adjust to that force, and so on. And so, even though we haven't really learned that much about it, they are playing a really integral role in how the back can move. Will it be preempted in terms of certain movements by pain? We can have trigger points. If you have a trigger point in your neck from a multifidus, it's a very deep pain. And it can be hard to reach because they are so buried in other muscles. So again, you may not have learned about it. The more medial muscles are the rotators that we may cover someday. And then we have multifidi. But then for those of you that have done acupuncture with me, we know that there is there's the spinalis group. Now they're going to be very medial, but they're going to be superficial to the multifidi. And then we have the longissimus group, and then the iliocostalis group. And you know how governor vessel channel for acupuncturists is down the midline. And then the inner bladder line is between longissimus and iliocostalis, and the outer bladder line is lateral to iliocostalis. But how many of you have been needling or paying attention to the Huato Jiaji points? And so if you see in this drawing, this is of the human back with the points. It's along those blue lines that we find the Huato Jiaji points. And so when I've taught about them, what we typically say is that it's a half sun. All these points are half sun off the midline. And I like to direct them medially into that laminal groove area. And that can help free up stiffness and address certain, localized pain and give you that restored ability to do some rotation. But these muscles being more on that dorsal surface, they would be more extensors, but they're thin muscles and they're small, but they're mighty because they're interconnected and there's so many of them, and they more serve a proprioceptive role rather than doing a lot of movement for you. But when it comes to thinking about how do we address problems in it, these Huato Jiaji points, half a sun off the midline, are going to be something we might think about, because that's going to go right into that groove that we're interested in. So paraspinal groove. So remember those as you're looking at this and trying to think about what to do. Okay. And so if we have problems in the multifidi, why would we have problems in the first place? Let's look at some of our postural habits. So those of you that are cat people and or have a cat in the vicinity, you know how the cats like to get on your computer when you are working. Well, the cat and we could become victims of poor posture. And so here I outlined in red where those problems are, and interestingly, they are both sharing that forward bend, that kyphosis in that mid-thoracic region. What can Kitty do to change that? Well, as long as she still has her claws, then that would be not hard to help remedy that kyphotic motion by stretching on a tree or on hopefully what would be a very solid scratching post and get some extension. So, what we can think about then is that it's important for us to think about where the spinal mechanics have gone awry. So, do we have a kyphosis again? It's a flexion, or excessive lordosis. With the multifidi, if they aren't firing well, part of it, like with horses, even, that you can become rather afferently disconnected from your back. So you're not really in touch with where your spine is. And even if I mention it to you, like the dog and the cat around the computer, that we tend to have this forward posture. If I remind you that along our back, the more we can activate those muscles, then we'll have a more stable back, we will have a better posture. And so just because of habit or because of injury or because of pain, a twist, something that shortened one or more of those multifidi, we or our animals might have adopted a problematic posture. And then when that happens, then that stabilizing influence of the multifidi isn't happening. And think about, especially for dogs, especially for someone like this one, who might have a TL disc disease because they were more like this, and then whatever, some genetics maybe, but also just too much non-strengthening of the multifidi, and we might have a paraplegic or paraparetic dog. And you can tell that if we were looking at these muscles in the paraspinal area along the Huaqiaji line, if those were weak or overstretched or painful, then maybe the dog can no longer resume that better posture. And once that begins to happen, then, as I said before, then we're losing that stabilizing influence of these muscles. And if something breaks down, if disc prolapse happens, and if they aren't able to find or get referred to a medical acupuncturist that can appropriately deal with this, or at least offer the clients the option of acupuncture, laser, massage, physical rehabilitation, things like that, to naturally recover the ability to restore movement in the legs, to restore that spinal nerve, spinal cord function. Then if they do get surgery, then what's happened is there has been a permanent alteration in the anatomy. And yes, they may recover their neural function, they may get rehab, but once you've cut into those muscles, we've disrupted the integrity. So might we think about not rushing to surgery for this and some other conditions? So anyway, in our community, we've seen so many successes of non-surgical thoracolumbar disc disease treatment that it's a very compelling option instead of rushing to surgery, and we're not disrupting these muscles. All right. So aside from the big problems with disc disease and paralysis, what else can we think about with other species? What about horses? And so it's not natural, it's not evolutionarily designed, or the thing that happened that they expected, or that their bodies were going to have a rider on them with a saddle that was good or not good. But in any event, now we have horses that have riders on them. And what happens when there's a rider on the horse's back? Well, there's the pressure on the spine. If it's not a well-fitting saddle, there's going to be maybe asymmetric, but undue pressures on the muscles and the nerves. And guess what? Perhaps those multifidi muscles as well. So, what's that going to do in the long run? Did we ever think how, if horses have freedom of movement and can roll on the grass like this, can they exercise their multifidi? Can they stretch them? Can they strengthen them? Can they lengthen them? Because the way that these muscles are designed or built or just happened, yes, we have them going mostly up and down, but there is a capacity for some rotation. So when we want to think about protecting them with strengthening or rehabbing them or treating pain, whatever we want to do, we can think about, okay, which directions do we need to include in that therapeutic motioning so that we can help restore these multifidi to their proper length. And that's why that horse rolling on the ground, they're feeling it and they can work on it themselves. For us, we can learn also from dogs. The bird dog posture, and some of that appear to have that genetically, or whether it's just acquired in learning how to hunt and all that, that when they're focusing, they may lift their arm. Well, this is where in yoga, a pose that has been shown to be helpful for the multifidi in terms of strengthening and in part lengthening, if you do this on both sides, is going to be the bird dog pose, where you have one arm extended forward, you're on that same knee, and then you jut out in an extended knee format your opposite leg. And that is shown to help strengthen and the multifidi and lend that stability that we need of the spine. However, some exercise physiologists have also looked at what's the contribution of different exercises to multifidus health. And it appears that the Superman pose is more effective in repairing the strength and stabilizing forces of your multifidi. But it's not just laying on the ground, or that would be super easy, but it's the extension. And you can probably see where that is going to help throughout the spine, especially if you keep your neck a little bit flexed and don't arch it backwards. All right. Another thing we can think about from doing for our rehab patients, if we're doing canine rehab, is that how can we just in the home help animals recover and maintain the strength of their back? Well, here in this exercise, you can see that the Basset has a nice straight back. It's probably younger, but is having a nice strong back curvature. And you can even see in the bottom left there that the tail is a bit extended. So that's working out pretty well also. And so, yeah, I think that's the main thing. So to recap, how do your multifidi get injured? Well, inadequate or incorrect exercise, pressure on the spine, for example, a saddle, or even now that there are dogs that are having all this gear and they're having to go on a hike with all this gear on them and on their back, we can think about how does that make them have to compensate, and is anything pressing on areas that it shouldn't? Again, back surgery will weaken the spine. Yes, we may take care of a problem, but we are interfering with the continuity of the back muscles here. And that's not going to come back. Yes, maybe we can compensate elsewhere. And yes, maybe that was needed, but it's not nothing. So we have to remember that. And then even before we would get to a catastrophic event like that, perhaps we can remain cognizant of those postural changes that we might see that might start becoming a problem. And as veterinarians that are involved in this work, acupuncture, rehab, physical medicine, just even general medicine, that we learn to palpate And we identify the muscles that could become involved if there are postural changes. So observing first, seeing if there's a problem, but ideally our myofascial palpation with a cross-fiber approach will identify areas of banding. But if we haven't ever learned of certain muscles and their role in helping movement and comfort, then we may not be looking for them. So just wanted to remind you that now that we are teaching anatomy with the help of skeletons, and this is Play-Doh, but we can use other things, other types of clay and whatnot, that it's so illuminating to really fully understand that we have about 4 different layers in the back of muscles. So rotators and multifidi, transversal spinalis, longissimus, all that, and then the broader muscles, rhomboids, trapezius. Until you really build it, you don't fully understand it. And so to make a better diagnosis, the more we know about anatomy and where those things are that were lurking that we weren't really sure about or never heard of, the more we'll be curious and the better a diagnosis we will make. So what can we do to help when there are multifidus problems, when we suspect there might be? Well, acupuncture for one thing, and so here's my guy here, and just going to show you if we're doing the Hwata Jiaji points, how I like to angle them. These aren't acupuncture needles, obviously, but we can come along the spine and see where was this dog tender, where were they weak when we palpated on there, and even that when we are inserting the needle, the acupuncture needle, after we do a properly run program and have our veterinarian degrees and all that, what's the status of the tissue as we enter with an acupuncture needle. We can also think about massage, stretching, ultrasound if need be, PEMF loops, etc. And if I didn't mention laser, of course, but then also therapeutic exercise, dynamic mobilization, which has become studied much more for multifidus problems in horses, and just having them do things that are actually calling upon their body to just naturally normalize spinal mechanics, like I showed you with the cat scratching on the tree, that sort of thing. So animals need freedom to move, to climb, to jump, to run, to roll around on the ground. And when their outside movement is too heavily controlled, they are not able to fix themselves like they should. So if there's no questions, feel free to email us at info at curacore.org for any further questions. We're going to be doing these on a regular basis, hopefully every 2 weeks, and we'll tell you about courses as they come live. We have one this fall on the myofascial relationships of acupuncture points. All this leading to the conclusion that anatomy holds the key to some of our most perplexing pain problems. And we don't have to wonder, we don't have to image it to, a full, huge, expensive extent. The first thing we should be doing is palpating and observing and even doing some treatment and seeing what is the result of that. Because as we restore intercommunication in the multifidus muscle and all these other things that we've talked about and will talk about, then the results can be very amazing. So I see that there are a couple of questions. Facebook users, so you're on the private Facebook group. We're going to fix that in the future. We'll have you opt in from our private group, the Veterinary Medicine Elevated Group for CuraCore graduates. And then you can, I'll see who you are, which will be fun. But do harnesses on dogs cause issues? Yes, I'm sure that they could. And that's been something that we've discussed in our acupuncture course and our rehab course. How is that harness going to impact the neck, the back, even the shoulder movement? So all those things are important to consider and not have too restrictive. That could definitely happen. And also any types of constrictions around the face. I mean, it's as we talked about with the rhomboid video, that moving the head and neck are so important. As we talked about with the suboccipital muscle video last time, moving the head and neck is so important, not only for the mobility and the pain, but also because we have these connections between the dura encircling the central nervous system and our myofascia. So by moving our head, we are actually helping our cervical cord and the circulation of cerebrospinal fluid. Yeah, thank you, everybody. What do you recommend? Which is the best harness, depending on dog side? And then also choke belts. Email me on that, and then we can talk about harnesses. It's going to be dependent on that type of dog and where you are in the world and what kind of options you have access to. But we're getting more and more information about less just constricting harnesses, which would be helpful. But always think about that. Once you start to recognize the importance of movement, of everything from the midline out, it's a little bit overwhelming at first, because these were things that really, we should have been thinking of all along, but we were taught differently. So hoping to remedy that now. But always, like the how to see a dog, if they have their neck and cat, if they have a ventroflex neck, that's a big starting point. Why is their neck down? Is it because they can't move it up? Is it because it hurts to move it up? Are they weak? And so on down the line. All right. Well, this was fun. And what we're going to be doing next time is looking at the quadratus lumborum. So thanks for your participation and your sweet comments. And I will see you soon.